here with a stalwart in the medical industry, Dato Dr. Noorul Ameen, the Executive Chairman of Qualitas Medical Group. Dato has come a long way, many successes. We're here to talk about some of his thoughts and views on the industry. Dato, welcome to Brand Malaysia. We're in partnership with the University of Nottingham and today with the Malaysian Medical Association in this production. Can you tell us, Dato, a little bit about your early years and how you began this business?
Good afternoon, MC, and thanks for the opportunity. Prior to starting this organization, I was a practicing doctor in a group called Qualitas Medical Group, where I was the MD of the group and managing. This was in late 80s, early 90s. Mm-hmm. As the healthcare delivery system was evolving, what happened was this. Third parties came into the picture, third party administrators, managed care came into the picture. So I realized that the norm at that time was changing. The payment mechanism was changing, the way we deliver the care was changing. So I realized that unless the doctors, especially the private sector, general practitioners, more organized, dealing with this intrusion into the norm or the new norm, may not be possible, and I think we will be shortchanged in many ways. That gave me an idea to really start a well-organized primary care delivery system in Malaysia, which will be able to deliver quality care to the patients. At the same time, we are organized to really deal with this kind of third-party management organizations, as well as that we don't shortchange anybody. All stakeholders treated equally along the line.
Was there a benchmark that you paralleled yourself with then? Did you get this idea from another country? Or?
It's an interesting question. There are well-organized primary care groups at that time in Singapore and other parts of the country, especially more Western countries, which were stood for very quality delivery of care, as well as they were paid equally well for the delivery and the care of the patients. There were some of those ideas I had, but I think each country has got to see different benchmarks and different way of delivery. So I had to refocus and readjust the way I want to deliver. So I wrote a business plan based on my experience and listening to others, visiting other countries, how we can structure this organization to suit the Malaysian market.
Were you afraid at any one point when you started that you would fail?
Sure. From day one.
From day one.
From day one. I was not worried, but I was prepared to fail. Because if you're not prepared to fail, I don't think you can see success. Any business ventures you start, you must look at what's your safety net? What are you going to do? And the chances of failing is always there. I always say that beyond every successful entrepreneur, there are thousands of unsuccessful entrepreneurs who have gone wayward. So I think that was always in my mind. And every time I used to have a check and balance on my progress to say that, is it going to go progress or shall I cut my losses and step back?
As we know, the private practice doctors flocked to you. They registered with you or they franchised or sold their clinics to you, and you started to manage it generally in a manner of speaking. And what is the number today, if I may ask?
We have in our network about more than 200 clinics, which we are associated with the Qualitas Group, stretching from Perlis to Johor. We work with about 170, 180 doctors across the country. And we have been, as you know, we have been in existence last 23, 24 years.
Yes.
And we've got a good working relationship with the doctors as well.
Would that make you the largest private care in the country?
I would think we are one of the largest network of private practitioners in this country, one of the largest. I'm not sure whether I'm the largest, but I'm sure we are one of the largest practitioners.
When you started in this business in Qualitas, Doctor, what has changed today? Each time you look back and each time you look at a new entry, what's really changed in the business?
I think in the space where we are working in the primary care, a lot have changed over the past. a couple of years. I think if you go back to about 30 years back, even before I started Qualitas, there was a relationship between the patient and the doctor. It was more of a family practice. The patients know the doctor well, and then either their father is gone or the brothers have gone. There was some relationship with them, and the patients trusted the doctors.
Yes.
And also, I think there was a payment mechanism where the doctors know your socioeconomic situation. They will either charge you or not charge you. It was a very flexible mode of doing things.
There was some compassion.
There was some compassion, and they will know each other. But things have changed, become quite commercialized in that factor, because I think and also the advent of internet and then the social medias, a lot of necessary information, but there also a lot of unnecessary information traded in the social media. So sometimes the patients are come to you, prejudge the whole thing, and the expectations may be beyond what the doctor can deliver.
Sure.
And the doctor is put in a quandary, and also the payment mechanism has changed. They are either paid by their company or by insurance or things like the payment mechanism changed. So I think many factors has come in between the relationship of doctors and the patient in the recent years.
Yeah.
So managing that as well as making sure you deliver a good quality care system is also challenging.
Yeah. Is there a personal motto over the years that you ascribe to? That you wake up in the morning, look yourself in the mirror and say, this is my motto.
Yeah. I think my motto is, be whatever changes that come. Whatever happens, I think the doctors or in my organization, we must give quality care to the patient. Immaterial of the cost or immaterial, we must have good clinical outcomes. That is my main objective.
I'm going to put you on the spot. What about the quality of the doctors being churned out today as opposed to in your early era when, in that day?
Yeah, I think it is a very sensitive question. I think the training modes might have changed. I think doctors have gone through this process of 5 or 6 years in a medical school. They go through more or less the same process, but the teaching methods and the way it is being taught or prioritized may be different. I think any doctor has gone through a medical school, if they are properly trained, properly engaged with the way you deliver and all that, they can come around. It's whether the doctor is willing to really get himself trained to the whatever delivery system is needed, I think it can be done. The problem is some doctors do not want to be trained in that aspect. I think that's where the problem is.
Yeah, and in that vein, taking off from there, when you compare, you've traveled extensively to do business everywhere, and when you compare our local Malaysian scenario with the countries that you benchmark yourself with now or you're operating in now, what kind of way does Malaysia have to go?
I think Malaysia has to go a long way. I think the reason is this: there is a disconnect between the governance of medical and in the delivery system, the payment mechanism and the quality control. There is a total disconnect. I think in this country, the Malaysian Ministry of Health is everybody. They are the governance, they are the implementers, they are the ones who are setting up the law, and they also are providers. They have their own hospitals, they have their clinics, they are also the governance, and they are also called the shots. And indirectly, some of the private hospitals are also owned by government. Yes. And also that's one disparity. They've got what we call as a Private Services Act. Private Health Services Act. But where is the act for the public sector? Who governs them? Who governs the public sector? With the private sector, even you set up a clinic or hospital, you go through very stringent processes.
Yes.
What about the public sector? What about the public sectors? What about their clinics? Who is governing them? I think there is a dichotomy in the way things are being done. It should be transparent. To answer your question, in the countries we are operating other than Malaysia, I think there's a clear line between the ministry and the operators and the providers, public and private sector.
So there's better policing, better management, better administrative.
I would say not better policing, more rational in the way they police. I wouldn't want to use the irrational, but I think they need to come up to speed of what's happening around the world to make sure that I think you give liberty to operate, for the private sector to operate with restrictions and the proper governance, which is based on science, which is based on norms, excuse me, which is based on norms, and which is the world standards. Not invent your own kind of style of doing, which is really outdated in this country, and you stick to it for many years, and you don't want to change. There is no attitude that we need to look at it and change. You don't want to change. That is the biggest problem I see.
In Malaysia, we've one generation, I think, has nearly more or less grown up with the name Qualitas. What other countries are you operating in?
We are currently operating in Australia and Singapore.
I see. And the markets there, are they as challenging or as successful as it is here in Malaysia?
It is in Australia. It is a developed country. Yeah. So is Singapore. I think many issues and the way we operate have been very streamlined and governed in a stringent manner. I think it is easier to operate in those countries than in Malaysia.
I want to just take you just a little bit off this tangent and ask you about the current pandemic and about your thoughts on the current management of the vaccine and the pandemic. And of course, everybody out there has a view, but you've been in the business industry. What do you think?
I think generally, they're doing a good job. I would say that. But there are areas which can be tweaked to better outcome. For example, I think vaccination is a good thing, but I think also screening has to go on, and also in targeted areas. I think the government has been very generous to fund the whole vaccination program. Actually, it doesn't have to. In the private sector, there are people who are prepared to pay for it. There has to be a parallel private sector vaccination program so that it is faster, as well as it's not a big strain on the government as it is now. More so, I think the screening as well as follow-up is also very important. The government has taken a Herculean task of doing everything by themselves, monitoring everything, vaccination and all that reporting. It's in a country like this, which we are marching towards being a developed country, that is not necessary. I think it can be shared with the private sector, and you can put a check and balance there. It could have been done much better, even though I think they've done a great job, but there are ways you could have done a better job.
Yeah. We hear today that there are many unemployed doctors, professionals, nurses even, and of course, the man in the street says that they've seen some doctors being go-get dispatchers or Grab drivers. What's your take on that? What could be done?
I think it is sad. I think it is sad to know that there are a lot of medical graduates who are waiting to be employed or unemployed. It's taking longer than normally it does. There is a disconnect between the need. It is on a needs basis. How many doctors' positions are there in the government? And we have got a law that doctors must go through a certain years of training in the government before you are fully registered at the medical council.
Yes.
So that process of waiting and getting it done has become a burden to the government because they're not able to accompany everybody. I think it goes back to what I would say, the way of planning. Manpower planning. How many doctors do we need in the next 10, 20 years?
And where?
And where do you need them, and what kind of specialty we need? And how many people can be trained? There are how many seats in the country? How many overseas? I think there was a move at one time that anybody going out overseas to train as a doctor must get an NOC, no objection certificate. So that that when you come back there will be a job because the human resources can be titrated. I think it was not there. So you can go, anybody can go any country and can get a medical degree. And you come back, there is no guarantee of a job. But it is really a quandary for having one side a legislation where you need to go through the medical process, the government process to be registered, and the other hand you don't get a job, you have to wait for so long. It is very stressful, not only for the doctors who come back, for their parents who have funded them all these years. I think there has to be something that they should be titrated on a needs basis.
Yeah.
Otherwise, there is still the obsession with some parents that they want their children to do medicine, and I don't know why. But and that goes on unless you have got a very clear system of how many you need a planning for the next 20-30 years, and say how many can be given an NOC, they can have the qualification to come back so they get a job.
Sure.
So otherwise, I think, I know a lot of doctors who come to see us. We have got a few doctors who are qualified doctors who are doing other jobs, managerial jobs, because they can't get into the government system.
In previous years, the private sector has spoken about ambulatory care. And is that still a highly anticipated viewpoint?
I strongly believe in that. I strongly believe this country should develop extensive ambulatory care, especially in the private sector, because as the advancement of technology advances in the medical field, a lot of procedures which are done in the hospital can be done in outpatient setting. It really controls two things. One, you don't have to stay overnight in a hospital, which helps you of the cross infection and the cost. Number two, I think the hospitals we build nowadays, thousands, hundreds of beds and all that is unnecessary. Patient can be dealt with in an outpatient setting at a lower cost with less mobility for them and good clinical outcomes. I think the government should really push for that, and more so the insurance companies, they should recognize treatment at ambulatory care centers as good as a hospital. But nowadays some insurance realize that, but many insurance still think any procedure you must go into hospital. So as you know, the doctors admit them just to comply with the insurance company, not because they need to stay in hospital.
Malaysia is churning out a large number of doctors, young doctors, and I just wanted to know your advice to these people entering into the medical field, the arena. What would you advise them to do?
I think to start with, I think the graduates or people who are out of school who wants to pursue a course in medical, I think they should have some kind of a counseling process where they need to be tested in their aptitude. Why do they want to become a doctor? And what is the reason, and how are they braced for the challenges ahead to deal with? Because many students go into medical school without knowing what to expect at the end of the road. What are the challenges waiting for them? And we have seen in the recent cases, many doctors in the government service, early stages, first, second year, they drop out. They're not able to continue. I think they should be counseled to that aspect, and they must also be counseled what you want to be. Is you want to specialize, or what have you got in your heart, or what you want to be, a general practitioner or family practitioner, or what kind of specialty. And they should know what are the opportunities in this country for them. Or are they planning to go overseas? If so, what are the opportunities in various other countries? I think that counseling bit and in making sure they are the right person for that profession has to be instituted. Now, when the parents say, okay, you're going to medicine, they go. Or I want to be, because my uncle is a doctor, I want to be a doctor. All those things are, I think, on the past.
Sure.
But going forward, there has to be proper counseling, and the doctors, the students who want to do medicine must be mentally prepared to expect what's the outcome when they come out of it.
To all the number of doctors, the medical professionals out there who are listening to you today, from where you sit and from the journey that you've taken, is there a strategic trend or an industry viewpoint that you would like to tell us about, that for the future? COVID has come and devastated not just us but everybody else. Is there a learning curve here?
Yes, I think it's a good question. I think there's a learning curve, and I think we need to sit back and realize in this profession, who are the stakeholders in this profession? And the stakeholders, the most important is the patient, him or herself is the patient. Number two is the provider. Provider is be it a doctor or the nurse or the frontliners. That's the second stakeholder. The third stakeholder is the people who are providing the infrastructure, support infrastructure, be it modalities, X-ray, this support system, or a hospital, or a ACC, or a clinic. Fourth is, of course, the payer. Who is paying for it? Is it self-pay from out of pocket, or is it an insurance, or is it a third party, or the corporates? All these things. These are all the stakeholders. I think there must be an equivocal outcome. That means it must be a win-win for all the stakeholders. Only then I think you can see good clinical outcome. End of the day, for any doctor, apart from all the financial thing, is a good clinical outcome he can come. A doctor is happy to see that he has treated the patient to an extent the patient is happy with the clinical outcome. I think that's what makes a doctor very happy. And for do that, I think there has to be some governance, which is very, very, very true. But also there has to be some kind of a liberal attitudes towards how the doctor can provide this service. It has been said, even in the Ministry of Health and ministers, the senior bureaucrats, that they think that the primary care is the most important factor in the delivery of care. They are the frontliners. But I don't see anything, any initiatives to make that happen. This country is still focused on specialist care. It's a referral system going everywhere. I think there is no motivation to build a primary care sector. I think unless the primary care system sector is developed into a gatekeeper system where everything is done, and referral to the secondary or tertiary there's a work progress. I think we are not heading the right direction. And in that context, what has this pandemic taught us? Pandemic has taught us a couple of things. One is the prevention, education, as well as how we can prevent such pandemic being spread so rapidly in various countries. It's a lesson for us to learn. And so, when there is something, this is not going to be the last pandemic. We are still going to see things coming in the future. How prepared are we to deal with these things? That can only happen if our public health system is well run, well managed, where we are able to prevent it at the beginning from spreading. And how do we work about that? Who are the frontliners in the public health? All these things are very important to know. I think it's important that we come up with a strategy, but the strategy, coming up with the strategy, should not rest on the Ministry of Health alone.
Sure.
They should incorporate the private sector, which sees more than 50% of the patients on a daily basis. I think they should be incorporated. It should be a public-private partnership to the health of this country. If that's not done, if it's still going to be continued dictated by Ministry of Health, and they call the shots without proper consultation and input, I don't think at the end of the day we would have learned that lesson.
Sure. That seems to be the cry of the medical community right now. I'm going to put you in the spot one last time and ask you about MMA, about the Malaysian Medical Association. Perhaps, two things that the MMA could do to be perhaps more, to relate to the Malaysian public and to stay relevant.
I think MMA has come a long way in so many years it has been in existence. It is still maintaining a good relationship with the Ministry of Health. That's a good part of it. And the other thing is the MMA president is only there for a year.
Sure.
Which is, I think it's a very short term. By the time they come and take over, it's time for them to leave.
Yeah.
So there is the MMA president comes in, is not able to make a good stand, or achieve anything at that point of time. They work as a team. I think the Minister of Health recognizes them as part of their ecosystem and get them. But are they able to change the way the Ministry of Health thinks towards what they think? Is a big question. I think they listen to them, but I think there are many incidences Ministry of Health takes their own decision. Contrary, maybe sometimes, maybe they listen to them. Are they relevant? Yeah. Relevant to an extent, I think, to whether there is a source of communication to the Ministry of Health. But are they effective? I don't think in the recent years MMA has really brought up any change to the private sector, or even, I don't know about public sector, in a way that I think it will suit the doctors, deal with doctors' issues. They are trying. I must say that I must qualify. It's not that they are not trying, they are trying, but I think all their pleas and pressures are not being really appreciated and heard. So this is no fault of the MMA officers.
Sure.
It is that we have not projected to be a very strong organization like the Bar Council.
Yes.
MMA should be strong as Bar Council.
Yeah.
See, the register in Bar Council, you have to register with the Bar Council to practice.
Yeah.
Here you have to register with the Medical Council, not with the medicalization. I'm not saying which is right, which is wrong. But there is no necessity for a doctor to register as a member of MMA.
Yes, yes, because you registered with the medical council.
It's just an association. So you're registered in medical council, and whatever everybody gets, you get. There's nothing. I think they are fighting very hard for doctors, but are they able to achieve what they want to do? Are the authorities hearing to them and helping them? Maybe to some extent, but a lot better could have been done.
A long way more to go. Perhaps.
Long way to go.
Yes, yes. I want to put you on a bit of a rapid fire question, so one word answers, and put you on the spot again. I know you're a busy man, but when I talk about movies, one of the favorite movies you ever watched?
I've never watched a movie for the last 45 years.
Is there a television picture that you like? Surely it couldn't have been all work and no play.
No, it's interesting, I don't watch movies, but I do watch National Geography.
I see.
And History Channel a lot.
Your favorite Malaysian food?
My Malaysian food is actually interesting question. Kway teow.
Kway teow. Will you ever want to look in the mirror and say, today I'm going to retire?
I've been doing that for a long time now. I've been right from the age when I crossed 55, I looked at the mirror and said, maybe it's time for me to retire.
Do you think that of all that you've seen in life, do you think it's time now to work hard or to work smart?
I think it's time to work smart. Working hard, many people work hard in this country for a living, but they don't succeed, they don't reach. I think you have to work smart.
Yeah. With that, Dato Dr. Noorul Ameen, we have great honor to talk to you today. We thank you. Brand Malaysia thanks you. University of Nottingham and the Malaysian Medical Association thanks you. Keep up the great good work that you're doing, Doctor.
Thank you, Mr. Dempsey, and thank you for the opportunity to address some of your questions and to highlight some of my what I have in mind regarding the issues surrounding Malaysian healthcare and Malaysian doctors. Thank you very much.
Thank you.